Very good evening to you all. Welcome back to my YouTube channel. I wish you all a happy new year. Today we are going to talk about the top resources which you need to study from to be able to ace the specialty exam and the European board exam. So first, looking at the blueprint for the exam, if you look, there are a total of 200 questions, and as we know, there are 100 questions in each paper, so there is total of two papers. If you look at the total composition of the questions and you look at the sections, so diabetes mellitus, diabetes diagnosis and general management, and the delivery of diabetes care, along with diabetes emergencies and management during acute illnesses and surgery, and the complications of diabetes. This itself forms around 68 questions out of 200. So that's a major chunk of the total 200 questions. And that is why the two set of guidelines, the NICE guidelines and the Joint British Diabetic Society guidelines, become extremely important to know in detail about all diabetes portfolio. So out of the 200 questions, 68 of them come from diabetes. Let's move on to the next slide. And looking at the passing marks, so usually they are equated according to the 2019 UK trainees performance. Now, the 2021 SCE exam, the pass marks was around 432, which was 56%. So basically, it was 112 out of 200. So the pass marks is usually established by equating based on the 2019 UK trainees performance. And in fact, all future examinations will use 2019 as the base form for equating until these standards are further reviewed. Coming to the book which you need to study by heart, it is the Oxford Handbook of Endocrinology and Diabetes. And the fourth edition will be the one to read through because that's the updated one with all the updated current guidance, the new developments in the diagnosis and management of the common and the rare situations. Also, it contains some information about COVID-19 and its aspects related to endocrinology and diabetes. There is also a chapter on transition endocrinology and about genetics of endocrinology. So each and every word of this book is extremely important. Different concepts will be cleared when we go through this book in detail, and we need to also pay special attention to the different incidences and prevalences mentioned in the book as well. So an extremely important book to know by heart if you want to pass the exam. Now, looking at the other resources, so as you are all aware that I have all my videos which are recorded, which are around 52 lectures, which I had recorded over the last 2 years. And this has all the updated guidelines about various topics. And all these lectures are case-based. So they are more easy to comprehend and also understand in terms of the guidelines. Now, if you want a subscription of this lectures, you can direct message me on my email and the WhatsApp number, which is mentioned here. And I will let you know the details of the subscription plan. I am sure you all must be all aware of my different videos, which are there in this subscription plan. In terms of diabetes, we have diabetes in pregnancy, where I have done a case-based approach for different scenarios of diabetes in pregnancy. There is a video where I have discussed the driver and vehicle licensing agency guidelines and diabetes. There is a video I have discussed about the classification of diabetes mellitus. And there is a lecture on the perioperative diabetes guidelines, where I have covered the Joint British Diabetic Society guidelines, which were published in 2021. Moving further, I have done a detailed lecture on diabetic retinopathy, where I have discussed the screening pathway. Again, several questions came from diabetic retinopathy in the previous exams. Also, in this lecture, I've shown all the different pictures which commonly appear in the exams. Then there is a lecture session on COVID-19 related guidelines for diabetes, which were published in the last 1 to 1.5 years. And again, they are part of the latest guidelines which were published by the Joint British Diabetic Society. I've done a session on the different cardiovascular outcome trials related to diabetes medications. I've done a very clinically oriented and practically oriented session on how to calculate and adjust insulin dose, how to calculate and adjust the insulin carb ratio, ISF, and the carb counting. There is a session on insulin pump education where I've discussed the basics of setting up an insulin pump and also the advanced training as regards using different aspects of the insulin pump. There is a very extensive session on the different causes and how to arrive at the differential diagnosis for the non-diabetic hypoglycemia. I've done a session on the guidelines related to hypoglycemia. Again, these are based on the latest updates from the Joint British Diabetic Society. Then there is a detailed lecture on steroid-induced hyperglycemia and steroid-induced diabetes. Again, here I have covered the Joint British Diabetic Society latest guidelines. Dr. Hia, my colleague, has done a session on diabetic ketoacidosis, and she has covered the Joint British Diabetic Society guidelines in 2021. All of these lectures are case-based and also incorporating guidelines into the cases, so it makes your understanding easy. In terms of another guideline, we have the guideline on the hyperosmolar hyperglycemic non-ketotic coma or non-ketotic state. Here I have covered the Joint British Diabetic Society guidelines, which were published very, very recently. Then there is a session on pituitary, in session on acromegaly. Then there is a session on pituitary MRIs. Here I've shown different MRIs which appear in the exams. Then there is a detailed session on Cushing's syndrome diagnosis as well as treatment, where I've covered the Endocrine Society guidelines, which are very important set of guidelines related to different endocrinology topics. Then I've done a session on the management of prolactinoma in the pregnancy. Here also I've covered a European set of guidelines. There is a session on pituitary apoplexy. My colleague, Dr. Van Murugan, has done a session on a case-based approach to polyuria. The details of a water deprivation test has been discussed, and of course, the differential diagnosis of cranial and nephrogenic diabetes insipidus is discussed in this lecture as well. Then there are some sessions in which I have discussed the previous exam recalls, the topics especially related to the thyroid questions which were asked in the exams. Then there is a session on thyroid uptake scan, different images and how to interpret them. Again, a very commonly asked topics in the exams. Then there is a clinically oriented session on case-based interpretation of thyroid function test. We have a thyroid emergency session on thyroid storm. My Prof. Stracken has done a detailed session on how to do a dynamic risk stratification and TSS suppression in differentiated thyroid cancer, and this was based on the British Thyroid Association guidelines. Then there are high yield topics of adrenal, again, which appeared in the past exams. Adrenal high yield topics of part 1 and part 2. Two sessions are there. All these questions have appeared in the previous exams. Then there is a session on Bartter syndrome, Liddle syndrome, apparent mineralocorticoid excess, and Gitelman syndrome. Then there is a session on hyperaldosteronism and Conn syndrome, where I have discussed the Endocrine Society guidelines. Also, there is another session on adrenal insufficiency. I've done a lecture on pheochromocytoma and paraganglioma. Again, I've covered the Endocrine Society guidelines here. And then there is an guideline-based topic of adrenal incidentaloma. In terms of endocrine emergencies, as I mentioned, pituitary apoplexy, thyroid storm, and then there is a very important guideline-based session on checkpoint inhibitor endocrinopathy. Session on Cowden syndrome, Menvan syndrome. In terms of reproductive endocrinology, also there is good coverage for gynecomastia. There is a topic, there is a detailed session based on the Endocrine Society guidelines on congenital adrenal hyperplasia. Then there is a session on transgender women, a very detailed session on the hirsutism evaluation and diagnosis, in which I have talked the differential diagnosis of hirsutism, PCOS, Then there's a session on management and treatment of PCOS and the different causes of hirsutism. Again, here I've covered the Endocrine Society guidelines on the same. There are topics related to hypocalcemia, hypercalcemia, and osteoporosis. In terms of osteoporosis, I've covered the NICE and the NOG guidelines related to osteoporosis. Then there is a very important section on familial lipid disorders and familial hypercholesterolemia. There is also a session on pediatric endocrinology where I've discussed about delayed puberty in boys, where I've talked about Kalman's and Plankenters and constitutional delay of puberty. Then my colleague, Dr. Rana, has done three important sessions in which he's covered all the high yield and the quick revision for specialty exam and European board exam and an MRCP. And it is done in form of three sessions. This is extremely important sessions before the exams to have a quick revision of all the important things which we can come across in the specialty exam and the European board exam. Now, apart from all of this, I have some upcoming lectures which I'll be posting in the next few weeks. Again, this will be available only to my paid subscribers. There will be a free view for around 10 minutes out of these sessions for the other viewers. So the topics which are coming up on my lecture series are understanding and interpretation of ambulatory blood glucose profile. Here I have explained the AGP profile and I have put across many case examples to help you all easily interpret the ambulatory glucose profile reports in your clinical practice. Then I've done a case-based approach for precocious puberty in girls. I'll be doing a nice case-based approach for the latest NICE guidelines in thyroid cancer, which are just published in December 2022. And then I'll be doing exam lab questions. Again, these are extremely important for the exams. There are around 200 questions, and I'm going to do a detailed explanation for all the answers. I'll be also doing a session on the exam recalls for 2021 and 2020, because these will be extremely important considering the 2023 exam, which is upcoming. And I'll be doing all these new lectures will be included in the same subscription plan price, and all of them will have a lifetime access as well to the paid subscriber. Now, coming to the question solving part, there are different resources for solving the questions as well. MRCP UK website has free sample endocrinology and diabetes questions. There are around 82 of them, and you can solve them from the MRCP website. And these are free questions. Again, very important in the exam. Sometimes you can get similar questions appearing in your exams as well. So make sure you solve them, and these are free resource available on the MRCP UK website. Then similarly for the European board exam, there is around 20 questions, free questions, which can be solved in the form of a sample European board exam. Again, on the European Society of Endocrinology website, you can get these questions. These are around free 20 questions as well. So both of them free, 82 as well as this 20 on the European board website. Now, in terms of question solving, which book do you need to really solve the questions? I'll highly recommend Prof. Atul Kahan's book of Best of 5 MCQs for Endocrinology and Diabetes SCE. Again, the question and answers in this book are exam oriented and helpful for both specialty exam as well as European board exam. Moving further, what online resources do you need for solving the questions? Study PRN website. There are around 800 endocrinology SCE questions, and the questions are more or less similar to how they appear in the exams. So this is one subscription which I will highly recommend to take for online. If you all have time, you all can take even the BMG on examination questions for endocrinology SCE exam. There are around 715 questions on this website. Again, it's a paid subscription. But these two are online resources for solving questions. The other two which I mentioned were the free sample questions. Best of 5 is a book, and these two are the online subscription which I will highly recommend. Now, going further, exam labs. There are 200 questions which are available in different groups. If you ask anybody, they will share with you the PDF. But the problem is, it just has the answers. It does not have any explanations. And these questions are extremely important, all these 200 questions, because in the last 2 to 3 years of, you can say almost 4 years, almost 20 to 30 questions appear from this exam labs. Sometimes it is the same question and the same options as well. So these are extremely important. And I'm going to do a detailed lecture session on exam labs with all the explanation and answers. So it will be very helpful for you all, and that will be uploaded in the coming weeks and will be available for full access to the paid subscribers. Now, talking about guidelines, what all guidelines do we need to read to be able to pass the specialty exam and the European board exam? So we'll go step by step. The most important for the diabetes is the JBDS, which is the Joint British Diabetic Society Guidelines, and the NICE guidelines. And you all saw that 68 questions out of the 200 are in the domain of diabetes and its complications. So this is extremely important, both the set of guidelines. Then I'll talk about the other guidelines as well, step by step. But these are all the guidelines which we'll need to look into to be able to crack the exam. Let's start with the Joint British Diabetic Society guidelines. Which guidelines out of the guidelines we need to know for the exams? So if you just put on the internet, on the Google, the ABCD and Joint British Diabetic Society, the guidelines will come up. But we need to know what we need to know for the exam. So first and foremost, the most important guideline is the hospital management of hypoglycemia. And I have done a lecture session on that, and that's why I put my picture here. So if you have my lecture series subscribed, you can easily interpret this guideline via case-based approach. Then the second guideline is management of DKA in adults. This was published in 2021. Again, we have a session on this in my lecture series. Dr. Hia has done this session for our lecture series. And again, the guidelines are beautifully incorporated in that case-based approach. Going further, management of diabetes preoperatively. So undergoing surgery and elective procedures. Again, these were published in 2021. Again, I have done a session on this for the preoperative diabetes guidelines. And all of this is case-based in my lecture series, so it's very easy to comprehend. Then there is a guideline on glycemic management during the inpatient enteral feeding of stroke patients with diabetes. This was published in July 2020, and I marked a star on it because this is one of my upcoming lectures in the coming weeks. Then we have the management of HHS in adults with diabetes. This was published in 2022. I've already done a guideline-based, case-based approach of the 2022 guidelines in my lecture series. So almost all of this in guidelines in this page is already present in that lecture series. Then moving forward, we have the management of hypoglycemia and steroid therapy. Again, I've already done a lecture in this based on the latest guidelines which were published in June 2022. So again, as you know, that all my lecture series are as per the latest updated guidelines. Then we have guideline on management of adults on diabetes, on dialysis. Again, it's a very important guideline. And then we have a management of the diabetes and hyperglycemia during labor and birth with diabetes. This was published in April 2022. So all these guidelines related to diabetes from the JBDS. Then we have a guideline on good inpatient diabetes service. This is basically in these different topics are incorporated like DKA, HHS, but I have covered this guideline in my lecture series across various topics for diabetes complications. Then there is a guidelines on diabetes at the front door, which also I have covered in my lecture series. And then there is a guideline on COVID and diabetes, which I have covered in my lecture series as well. So several guidelines of diabetes, which are very important out of those 68 questions, are already done by me in that lecture series. Now moving on to next important set of guidelines, which is NICE guidelines, which is the National Institute for Health and Care Excellence guidelines. So if you go to their website, basically you will go to condition diseases, and then you can see down here diabetes and other endocrinological, nutritional and metabolic conditions. In this, you'll find all these set of guidelines. You also need to pick up cancer and find the thyroid cancer guidelines, because this was just recently published in December 2022, extremely important for the upcoming exam. So in the diabetes guidelines of NICE, we have the type 1 diabetes, diagnosis and management. Then we have type 1 diabetes and type 2 diabetes management in children and young people. We have the type 2 diabetes in adults management, again, latest published in June 2022. We have the diabetes in pregnancy guidelines, which is already covered by me in my lecture session, and this was published in 2020. And we have the diabetes food problem guidelines, prevention and management, and these were published in 2019. So these are all nice related guidelines which you need to look into. Thyroid cancer guidelines, as I mentioned, I'm going to do a session very soon in the coming weeks, and these guidelines were just published on December 2020. Then there is a guideline on thyroid disease assessment and management. This was published in 2019, again very important. And there is a guideline in hyperparathyroidism. Again, this was published in May 2019. Again, very important from the NICE perspective. Then NICE has different guidelines in osteoporosis regarding bisphosphonates, raloxifene, teriparatide, assessment of wrist fragility fracture. If you go through my session of osteoporosis, which is in the lecture series, all of these has been covered. So, if you just listen to that lecture, you will not need to even go through these set of guidelines. Then there's a guideline on familial hypercholesteremia. This was published in 2019. Cardiovascular disease, risk assessment and reduction, lipid modification therapy. This was published in 2016. And there is a latest guidelines on obesity, identification, assessment and management. Again, very important for the exam. The question from the others come from this guidelines, and this was published in September 2020. Now, there is another set of guidelines of NOG, which is related to osteoporosis, and this I have already covered in my lecture session of osteoporosis. Now, the next set of guidelines, so we finished NICE, we finished JBDS, we had a look on the NOG, and then the next important set of guidelines, Society for Endocrinology guidelines. These are all UK-based guidelines. So there is endocrine emergency guidance for acute management of endocrine complications of checkpoint inhibitor therapy. I have already covered this guideline in my lecture series. So there is a good session case-based on this guidance. Then emergency management of acute adrenal insufficiency in adult patients. Again, I've done a session on adrenal insufficiency. I showed you in the picture there. And this is already there in the lecture series. Emergency management of severe symptomatic hyponatremia in adult patients, another guideline, very important. Emergency management of pituitary apoplexy, this I've covered in my lecture session already. Then there is management of acute hypo and hypercalcemia. Both of them have been covered by me in my lecture series. And that's why that lecture series is extremely important resource for the exam. Management of glucocorticoids during the perioperative period for patients with adrenal insufficiency. Again, this has been covered by me on my topic of adrenal insufficiency in that lecture series, where I've discussed how do we need to adjust the dose of the glucocorticoids surrounding the surgery. Then there is a guidelines published on endocrine guidance for inpatient management of cranial diabetes insipidus. This was published very recently. And there is a very important guideline on clinical practice guideline for care of girls and women with Turner syndrome. There were several questions asked from these guidelines in the last 2 years. Moving to the next set of guidelines, we have the European Society of Endocrinology guidelines. So there is a guideline on the management of functioning and non-functioning pituitary adenoma in pregnancy. I have covered the functioning aspect, the prolactinoma especially, in my lecture series. Then there is a guideline on management of adrenal incidentalloma. Again, I have covered this in my lecture topic of adrenal incidentalloma, how to approach. Then there is an important guideline on the management of chronic hypoparathyroidism in adults. An extremely important set of guidelines on UGOGO, which is published in the EJE, which is the European group guidelines on the Graves orbitopathy. Extremely important set of guidelines for the exam. These were published in 2021, and I marked a star here because this is one of my upcoming lecture in the coming weeks. Going forward, we have the European Thyroid Association guidelines. The important set of guidelines there is diagnosis and treatment of subclinical hypo and hyperthyroidism. Then there is a ETA guideline on thyroid disorders prior to and during assisted reproduction. There is an ETA guidelines on the diagnosis and management of central hypothyroidism. There is an ETA guideline on the management of Graves' hyperthyroidism, and a very important set of guidelines on the management of amidron associated thyroid dysfunction. And this is going to be one of my upcoming lectures. I marked a star here. So this is one of the important guidelines I'm going to cover. Again, these all set of guidelines helpful for both SCE as well as the European board. Going further, now Endocrine Society guidelines are US based guidelines, but all the endocrinology topics are covered in this guidelines. And that's why even for SC exam or European board exam or any endocrinology board exam, Endocrine Society guidelines should be looked into for all the endocrinology related topics, especially because most of them are not part of the other guidelines. So the important guidelines which are already covered by me and they appear frequently in the exams as questions: CAH, primary aldosteronism, primary adrenal insufficiency, treatment of Cushing's, diagnosis and treatment of pheochromocytoma and paraganglioma, diagnosis of Cushing's. All of this has been already covered by me in those lecture series, and I have based them on the Endocrine Society guide. Then there was a recent set of guidelines published in hypercalcemia. There is an important guideline on testosterone therapy for hypogonadism guideline resources. Then there is a hormone replacement therapy in hypopituitarism guideline. There is a session on acromegaly. I have already covered this as a lecture series. There is a very important guideline of Endocrine Society based on this, which is on acromegaly, and I've already covered this in my lecture series. Then there is a guideline on pituitary incidentaloma. There is a guideline on diagnosis and treatment of hyperprolactinemia. There is a guideline on hirsutism and gender dysphoria and gender incongruence resources. What's important to notice, the hirsutism guideline for Endocrine Society and the gender incongruence to a certain extent of transgender women have I already covered in my lectures. Then very important guidelines, DVLA guidelines related to diabetes. I've done a full session on the latest DVLA guidelines, so don't miss that session. This is a very important set of guidelines, which is part of that 68 questions which appear in the exam. So basically, to summarize the whole resources, first and foremost, Oxford Handbook of Endocrinology and Diabetes, the 4th edition, along with my lecture series of diabetes and endocrine. These two will be your basis to start studying for your exam. Then when it comes to question solving, we have the MRCP website questions. There is European board website question as well, 20 questions. Then online solving, study PR and BMJ on examination. Then solving questions with the book, Best of 5 MCQs by Prof. Atul Kahan. What we need to know is further exam labs, the 200 questions, and you should know the question answers and the explanations to get a more hang of the questions as they appear of the exam. And I'm going to do that session for you. And the previous exam recalls of 2022, 2021, 2020, extremely important. In terms of guidelines, as I mentioned, JBDS, NICE, the crux for diabetes, Society for Endocrinology, European Society of Endocrinology, ETA, DVLA, and the Endocrine Society guidelines. So these are all the summary of the resources which you need to know to ace the specialty exam as well as the European board exam. And again, before I finish, do subscribe to my lecture series. It will really help you all to pass the exam. It is 52 lectures at the moment, but the upcoming lectures will all be available as free access for the paid subscribers. There will be only a free view available for 10 minutes for the other viewers. So if you want to subscribe to the lecture series, do message me directly on my mobile number, which is mentioned here on WhatsApp, or you can email me as well. Thank you so much.